Okay, I think this is recording. So let's go share screen. And this is going to be a review for test 6. So hopefully this is showing up. Looks like it is. All right. So we'll just start with digestive, then we'll go through urinary, and then reproductive. It's going to be really fast. This is just a review. So here's some teeth. Make sure you know incisors. These are centrals. That's a lateral. You don't need to know that. Just know they're incisors. That's a canine or a cuspid. These two are premolars or bicuspids. These guys, same. And then you got molars, molar. So first, second, third molar, you just need to know molars. Those are for grinding. Okay. So make sure you can point those things out. This is the gingiva, of course. Okay, that's the tongue. Okay. Here's a tooth. I could point at enamel. I could point at dentin. I could point at a pulp chamber, pulp cavity. This is a root canal, and that little hole is an apical foramen. What's on the outside of the root? I don't have a good place to point at it, but that's called cementum, cementum. And in between the cementum and the bone over here, the alveolar bone, would be the periodontal ligament. It's not showing on this drawing. Okay, so here's a half-head model. So there's the tongue again, right? Don't forget uvula. I could show it from another angle too. That's uvula. I guess technically we could go oropharynx, laryngopharynx, but you had that on the last test. Okay. On the outside of this model, of course, you can't see it here. You got the salivary glands, so don't forget you have parotid gland on each side. You got the submandibular glands on each side, and you got the sublingual glands. So make sure you look those up because I don't think I have a picture of that here. There's a uvula right there, soft palate, uvula, tongue. And then if you lift the tongue up, there'll be that little frenulum under it. Remember the little lingual frenulum? That's a little, you can see a little piece of a frenulum there on that labial side. Labial just means a lip. Okay. So here's big pieces and parts. Make sure you know esophagus, stomach. The little rugged foldings inside of here are called the rugae. Remember the rugae? Don't confuse them with what's inside of intestines. This is plicae, these little foldings. You can't really see them here. That's the cardiac sphincter, pyloric sphincter. That's the fundus. That's the greater curvature. That's the lesser curvature. Here's the liver. They kind of pulled it out and up. But there's a gallbladder underneath it. You can see a little bit of the cystic duct there. There's a pancreas with the pancreatic duct. Here's your colon. That would be your cecum. That's your ileocecal valve. This ascending colon, transverse colon, descending colon. They didn't do it too well, but it's sigmoid colon here. Then you have rectum, and then anus, anal sphincter, and then out. So this small intestine. It's jejunum and ileum, but I would make you do that on this model. And this would be the duodenum coming out of the stomach here. Remember, the duodenum is only about 10 inches long. This little strip of muscle is called the tinea coli. I know it's a little blurry. Tinea coli. And then the little outpokings like that and that and that and that, those are called haustra, Haustra. Haustrum, ending in um. That would be a single one. There's the ileocecal valve. You can see it a little better. I guess that's the appendix hanging off there. Okay. Small intestine. Okay. Oh, this is nice. I don't know where I got this picture, but they cut it. But now you can see the greater omentum. I kept looking for a good picture for you guys and finally found it. So there's the greater omentum. Of course, it would go further over because it's hanging off this whole greater curvature of the stomach. There's greater omentum. And you can see the tinea coli. You can see the haustra really nicely. Okay. There's a liver. There's the gallbladder. Here's, right and left lobe of the liver here. This is falciform ligament. Remember that? Falciform ligament. Um, Here, you're just looking at the pancreas. This is a spleen. Don't call it a kidney. That's a spleen. There's your pancreatic duct. Okay. There's your plica or plica, however you want to say it. Singular would be plica. That's just the foldings inside of that intestine there. Okay. I got this because all the small intestines have been taken out here, and this is your colon, but even some of that's removed. But I finally found for the mesocolon. Remember mesocolon? That's that other connective tissue sheet that's holding that colon to the back wall. So I finally found a good one there. They're showing tinea coli and Haustra there. There's plica, a little blurry, but this slide would be good for mesocolon, I guess. This is the esophagus on a long cut, so the food would be going that way. Okay, so how you know it's esophagus is first of all, it's stratified squamous, right? And it's non-keratinized stratified squamous, of course. And then this, believe it or not, I kept telling you it was patchy. That's the muscularis mucosa. Now, in most of the rest of the digestive system, it just looks like a little stripe or a strip. But now, for some reason, in the esophagus, it's real patchy. So if you see stratified squamous and you see a patchy muscularis mucosa, boom, you're looking at esophagus. Okay, you're just backed out. Okay, this is a beautiful picture, by the way. So here's your patchy muscularis mucosa. Here's all your stratified squamous. This is cut across, so the food will be going up and down. I mean, it will be going down in this lumen here, right? Okay, then you have submucosa. And then you got 2 layers of muscle, and the muscle looks kind of weird in the esophagus. It's not too weird here. But it can be skeletal muscle in the upper third is why it looks kind of funny if they do an uppercut. Remember, you don't have a tunica serosa. Out here would be tunica adventitia. It's a beautiful cut of esophagus. So I can point here and you would go muscularis mucosa, patchy muscularis mucosa. What organ is this? Esophagus, because look at the stratified squamous. There's your tunica muscularis externa. There's your submucosa. And I wouldn't point at it, but I could ask you, the esophagus has what layer is the outermost layer of the esophagus? You go, tunica adventitia. This is really nice. So here comes the esophagus into the stomach. There's the fundus, right? This is the cardia region, so that'd be the cardiac sphincter there. This is, well, it would be going to the pyloric sphincter there. These are rugae. Pretty nice. Okay, lesser curvature, greater curvature. This is you've probably seen this model in the classroom before, but it's villi, not microvilli. Microvilli are tiny, tiny, tiny. They would be on these individual cells right here on the apical surfaces. But this is an intestinal model, right? So these are villi. You know, this might be in between plica. Plica are huge, right? So anyway, this from here up to the lumen would be up in here. That is your tunica mucosa, because this little strip of muscle is a great place to show it, hint, hint, muscularis mucosa. And so that does look like a nice little strip. You can see it's not patchy like in the esophagus. That's a Peyer's patch, by the way, and that's a lacteal. Remember, lacteal are inside of villi. This is submucosa. Here's your 2 layers of muscle, inner circular, outer longitudinal, tunica muscularis externa, and way out here would be your tunica serosa. Can't really point at that, it's not that great, but this is really nice for your muscularis mucosa and your villi. And your 2 layers of muscle. Don't forget inner circular, outer longitudinal. This are villi under a microscope, really nice. So just go, if this under a microscope, just go small intestine, right? Look at this beautiful muscularis mucosa right here. Right? Here's submucosa, and there can be glands in there. And here's your 2 layers of muscle, although it's hard to see them both here. But that's your tunica muscularis externa, and then the outside, which you're not going to really be able to see, it's just a little slick epithelial layer, maybe a little bit of connective tissue on this side of it. That would be your tunica serosa. But these villi are beautiful. Yeah, absolutely beautiful. This is a liver. Okay, so this pig liver, which looks way better than the human liver on our slide because you can see the central vein, it's no way to miss it, right? So these are these little lobules, right? And don't forget, you'll have these little hepatic triads. Generally, you have 6 of them around a lobule. So that right there is a hepatic triad. It'll have 3 little vessels in it. Remember, it'll be like a little bitty bile duct, a little bitty hepatic portal vein or venule, and a little bitty hepatic arteriole. Now, I wouldn't make you, especially at this level, I wouldn't make you figure out which one's what. I would just point at this whole structure. What is that, a triad? Name 2 of the 3 vessels that can be found there. I'm giving you a hint, right? What is this? And that would be central veins. Beautiful. This one too. Beautiful. Okay. So here's a gallbladder that the red arrow is pointing at. That's the cystic duct. Remember the cystic duct? They thought this was a big cyst when they first started dissecting years and years and years ago. They go, everybody has a big green cyst. So they named this the cystic duct. This is coming out of the liver. You know, you have a right and a left hepatic duct. And so this would be your common hepatic duct. And where the cystic duct and the common hepatic duct come together, that's your common bile duct. So the common bile duct empties into the duodenum. And don't forget, you got the pancreas down here, and the pancreatic duct is emptying into the duodenum too, and they're pretty close together, those where it empties. So this is a pancreas. Beautiful slide. That's an aisle of Langerhans. So remember I said they look like ghosts? So they look more pale than the rest of it. So this, you can call it pancreatic islet, that's fine. And these are your acinar cells, A-C-I-N-A-R, because they're like little cul-de-sacs. And basically that's what acini structure looks like. So these things are flowing into these little ductules, which flow into this, bigger duct. And so this is your exocrine part. This is making your digestive enzymes. This is endocrine parts. So these little aisles of Langerhans, they're making your insulin and glucagon. So these don't empty into a duct. Remember, endocrine is ductless. So those are going just empty, basically just oozing their product out. It's getting picked up by the capillaries and transported to wherever it needs to go. Remember, insulin and glucagon. Insulin lowers the blood sugar, glucagon raises it, remember? This is real nice up close. If you see this many goblet cells, see all these goblet cells, you know you're looking at colon. Almost every other cell, it seems like, is a goblet cell. So these make mucus, right? So there's goblet cells all over. You got them many places, many organs, but this, you have an exceptional number of them. So when you see that many goblet cells, you're probably looking at colon. This is a little bit backed away. And colon, it almost looks like somebody took a putty knife and just kind of flattened it across there. Notice the way it doesn't look like villi or anything. So that's another way you're looking at colon. And then you see all of these goblet cells, that's colon. There's your muscularis mucosa. It's pretty nice and thick right there. Okay. Here's your 2 layers of muscle. That's your submucosa. So that's a pretty nice slide. Okay. This, however, is the stomach. So remember, it's all simple columnar. Stomach, small intestine, large intestine. It's all simple columnar. You just have to look for your clues. Here's a big clue. See that little gap right there? It's a gastric pit. And they go down into it didn't get a good cut, but they go down into the gastric glands. And remember, that's where your chief cells and parietal cells are down there. Remember, chief cells make pepsinogen, parietal cells make HCl, hydrochloric acid. Here's a nice little muscularis mucosa. Right? So that's stomach. You see the simple columnar, but you have a nice gastric pit. Now we're moving on to the kidney, right? So this is a close-up of a renal corpuscle. Remember, a renal corpuscle is a Bowman's capsule plus a glomerulus. Those two things together are called renal corpuscles. So this would be probably my afferent arteriole that's bringing blood in, right? Efferent bringing blood out. That's my proximal convoluted tubule. The filtrate would be captured in here. That's the JG apparatus. I don't really like the way they drew it, but it's the only place I have to point at it, hint, hint. So if I point at that and go, what is it? You just go JG apparatus. Makes one hormone and one enzyme. What are they? EPO's the hormone, renin's the enzyme. That's a distal convoluted tubule. Where's my pointer? There. Remember, it comes over real close so that you can have crosstalk here. Now, what I do like about this model, they're just showing it on half the glomerulus. They took them off on this side, but these are your podocytes. Remember, your podocytes have the little fingers called pedicles, and in between those are the little filtration slits. So the podocytes help control that filtration. They just took them off on this side, right? So it's an unusual situation. Afferent arteriole coming in, then you got a little capillary glomerulus, a little bowl of capillaries, then efferent arteriole going out. So it's that since it's two arterioles, it can help control how much is filtered here, basically, by changing their diameters. So don't forget the big stuff: kidney, ureter, bladder, urethra going down through the prostate right here. So this is a male because you got a prostate gland, right? The little triangular area there is called the trigone. Remember, rugae, just like you have inside of the stomach. Those are just foldings. Don't forget your adrenal gland, right? Those are adrenals, right? And you can see the pyramids, but we're too far away. Now, the connective tissue on the outside of a kidney is called a capsule. All right, so had it in the wrong spot. But anyway, backing up again, this is small intestine also. So these are villi, really nice. This is a crosscut. Here's your lumen. These are villi. These little islands that are floating, they're all part, like that is part of this. It probably just made a little bend and it makes it look like it's a little fingertip floating by itself, but it's really part of this. It's just the way it got cut. So lamina propria is the stuff inside here, the connective tissue in there. So this would be, you can't really see the muscularis mucosa very well, but this is submucosa. And here's your two layers of muscle right here and here. And so that's tunica muscularis externa. And then way on the outside would be the serosa, but I wouldn't point at that. But you can have glands. See these glands right here. Okay. All right. Okay, so back to kidneys. There's everything we just did. Now we're zooming in on a pyramid. This is a pyramid down here. So that's in the medulla, remember? This is the cortex out here. And now you're seeing a nephron, right? There's a little glomerulus, proximal convoluted tubule, loop of Henle, distal convoluted tubule coming back close, connecting tubule or collecting tubule, I don't care either way, and then collecting duct. And then that flows down here and it's going to go into a minor calyx. Don't forget your vessels. Here's an interlobar artery. There's vein, interlobar vein, and an arcuate artery and vein. And that would be an interlobular artery going there. Interlobular would be these little guys. Beautiful picture. But you're looking at the front here. Excuse me. Because this your aorta, and here's your vessels, renals, right? It looks like the superior mesenteric there. Anyway, it's just a real nice picture, and there's your ureters, and see the way the ureters go into the back of the bladder. Okay, so this is kind of nice for showing the minor calyces. I know it's a little blurry, and the major calyces. Calyx is singular, calyces plural. That's renal pelvis, rhymes with Elvis. And then there goes the ureter. I'm saying it wrong, so pronouncing it wrong, so you'll spell it right. Ureter, Ureter. That's normally the way you pronounce it. Okay. Don't forget your renal artery and vein there. That's just showing you the front and the back, remember? So here's the back. You know, you're looking at the back because you got these seminal, this male, because you got the prostate. So you got these seminal glands here. You got the prostate gland there. You can just see the way the ureters are coming into the posterior of the bladder there. And that's just showing you the trigone again. Don't forget the three-layered muscle of the bladder is called the detrusor. Remember, detrusor, three little layers. This is probably better for showing the minor calyces, right? Pyramids are really good. Pyramid. Of course, they're drawing these nephrons way bigger than they really are. Remember, those things, you got 1.25 million per kidney. Then they got renal columns. This would be the cortex. Don't confuse the cortex with the capsule. Okay. Better picture of the trigone right there. You can see the way the ureter is coming in through this little slit-like orifice right here. And right here, the other one's coming in behind there. Showing the muscle pretty good. So I think we're good. There's the prostatic urethra. Now we're looking at a glomerulus under the microscope. Look how nice. And you can even see the Bowman's capsule. It's simple squamous. Look how skinny it is. See these nuclei? See how flat everything is? That's how skinny simple squamous is from the side right here. Almost looks like a little pencil line. So the filtrate's collected in here. Beautiful pictures. Okay, so this is glomerulus. That's a Bowman's capsule. So the podocytes on these capillaries would be your visceral layer, and the Bowman's capsule would be the parietal layer. I'm not going to get that picky, I doubt. This just showing it, you know you're looking at the cortex because you see the little meatballs. Remember I said they look like meatballs? And they got the nice little space around them. See how different this looks from a pancreatic islet? That's the only thing you could possibly mess it up with. So these are kind of dark, and then they have the little space around it. So you're looking in the cortex of the kidney because you got all these glomeruli here. Okay. Whereas if you're in the medulla of the kidney, you're not. This is just a bunch of tubules basically. So you have probably collecting ducts, and you probably got thick loop of Henle and thin loops of Henle. Like see these little guys here. I'm not going to get that picky, but you don't see any meatballs. You just see basically most of it is either simple cuboidal or simple squamous, ducts or tubules, or loops, I guess you could say. So anyway, that's what just look how different the medulla looks than the cortex. Same organ, different areas. All right. So now on to reproductive. So this is just showing you the prostatic urethra going through the prostate, membranous urethra going through this area right here, and then through the penis here would be the penile or the spongy urethra. Okay, there's the bladder. Okay, that little guy cutting across, it's not the greatest picture there. Representation on this model, that's the ejaculatory duct. You can see the corpora cavernosa. Well, one would be corpus cavernosum, erectile tissue here, and the corpus spongiosum around the urethra here. This will be the glans, penis. The foreskin would be the prepuce. The skin around the testicle would be the scrotum. That's the testes. I think they're trying to show a little epididymis, but I got a better view here. So there's the epididymis, and there's the testis, and there's the scrotum. This spermatic cord, it's going to have muscle around it, though. And all of that would be called spermatic cord. Remember the cremaster muscle that raises and lowers the testes for temperature control? The vas deferens is in here, and it goes, I probably have a better view of that somewhere. We'll try to find it. This is seminiferous tubule cut across. Really good view. So if you look, it looks murky in here. That's because that's a bunch of flagella. You can kind of see them. And these cells scattered around here, remember I said I don't know why they look like little triangles sometimes. That's your interstitial cells inside of these, that form together. That I don't know why they look like little triangles, but they do on the slides. I don't know if it's that way in real life or that just happens when they make the slide. Anyway, those are interstitial cells, and they'll release testosterone if LH, remember luteinizing hormone, will cause that to happen. This, I wanted to show you the difference. This seminiferous tubule, okay? The spermatids are being developed. They're immature there, right? Here's the epididymis. See the difference? So it's still tubes, basically, but nothing's being developed here. They're already done. These are your sperm. They're pretty much ready to go. And so you see, they're just in a mass in the middle. Nothing's connected to this outside here. Like here, this is where mitosis and meiosis and meiosis, however you want to say it, are all going on, right? But then once the sperm are free swimming, basically, now you're in the holding pen. So this is the epididymis. This is a beautiful picture of epididymis. Okay. That's just backed away. You're looking at the epididymis. So make sure you look at it both ways. Okay. And so look at all the sperm in there. Don't forget 500 million a day can be made by a healthy male. Okay. So that's a lot of sperm. So hopefully you see the difference between that and the seminiferous tubule. Here's a seminiferous tubule up close. See the difference? You got all this mitosis, meiosis, all that going on here. Here's the little spermatids with their flagella poking in, right? Totally different look. That's probably some interstitial cells, and that looks like a little arteriole there. Okay. Hopefully you can see that. And there's no way I'm going to point at nurse cells or anything like that in here. Just know this is a seminiferous tubule. What's being made here? Sperm, right? This female, don't confuse the urethra with the vagina. Okay, there's a fallopian tube, right? There's the ovary. There's your little fimbriae, although you can't see them too well. Here's the uterus. Don't forget you got 3 layers: endometrium, myometrium, parametrium. Okay. That's your cervix, where they do a pap smear. You check for cancer, cervical cancer. The little space around it they call the fornix. There's the vagina, right? I wouldn't do labia minora majora here. It's not that great. But here's the clitoris or clitoris, however you want to pronounce it. And that's kind of analogous to the glands, penis on the male. And that's where all the nerve endings, a lot of the nerve endings are. Whoop, just back up. And then this is the mons pubis, this fat pad right here is called MONS pubis. Okay. So this is just a little clearer version. And now you can see there's a nice looking uterus, endometrium, myometrium, parametrium. Nice looking ovary. You can even kind of see the fimbriae, the little fingers here. You can see the fallopian tube. So the ovary, the fimbriae, and the fallopian tube. There's a bladder, 3 layers of your uterus, don't forget. There's your cervix, there's your vagina, and there's clitoris and mons pubis. This is just a frontal view. I kind of like this because it shows the fimbriae really well. They're probably not quite that long in real life. It's like they took a little artistic liberty here. This is the ovarian ligament. Don't confuse that with the fallopian tube. You can call it uterine tube, but we have enough stuff starts with a U. I say fallopian tube. I didn't give you ampulla and infundibulum, so just go fallopian tube if I point at this. It's got a fundus, right? There's your cervix and then vagina. Nice. So there's a oocyte. This whole thing's a mature follicle or a tertiary follicle, and the space would be called the antrum. Okay, so once you ovulate, the cells that are left behind, these thecal cells that are left behind, that becomes your corpus luteum. Okay, and that puts out estrogen and progesterone. This is just a close-up. I thought that was cool. So here's an ovary, right? What they're trying to show you is an ovary that's ovulating. There goes a little oocyte. And then what gets left behind would be the corpus luteum. Corpus means body, luteum means yellow. And that's putting out estrogen and progesterone, preparing the body for pregnancy. If it doesn't occur, it just degrades and goes away and just becomes like a little scar. So I wanted you to contrast this. So it's still stratified squamous, right? So this is vagina. But the way you can tell that from esophagus, notice the way there's no muscularis mucosa, patchy muscularis mucosa down here, right? So that's only two things you could possibly get confused on this test, as far as looking very similar. But yeah, it's still stratified squamous, non-keratinized. Okay, and then we're done. So I'm gonna go stop there. Try to. And then we're going to go and then I'll put this up on the recording place for you. Okay, bye-bye.